Greetings. This is Mushtaq Memon, Professor Emeritus from Washington State University. Today's video is dedicated to examination of the male dog with the title, Is Your Male Dog Ready for Breeding? Understanding Stud Dog Health. I was presented with this 5-year-old German Shepherd dog named Boss, and come to find out that he had no sperm in his ejaculate, or he had a condition called azoospermia. Now, the confusing part was that he has already sired about 15 litters, but since the last year and a half, he bred about 6 bitches. None of them got pregnant. So the question is how you're going to go about and try to diagnose this problem. So we are going to conduct a breeding soundness examination on the male. Now, breeding soundness examination, or BSE, is done for many reasons. It could be like in Boss's case to diagnose infertility, or before you start breeding the dog, start using the male dog for breeding. So what we would call pre-breeding examination, just to make sure that he's okay to use for breeding, or for purchase or sale, that if I want to purchase a dog, I would like to know how is semen quality and what are the other parameters which are necessary for stud dogs breeding. Or if I want to, transport the semen from one place to the other, the recipient party would like to know what's going on with this dog and what they can expect. Or if you want to preserve semen, you need to know, what you are trying to deal with and what you expect after tying the semen, what kind of sperm motility and things like that you are going to expect. And then sometimes legal disputes, and I have been involved in a few of those, where a dog was sold, and after about 2-3 years, the buyers comes back and say, you told me this dog was really good, and I bred so many bitches, and none of them have gotten pregnant. They say, well, then it goes in the court, and the judge asks for the records. So when it comes to the record, it's very important that we have some form of recording that information, which is being collected during the examination. Now, this form, which you are looking in front of you, happened to be printed and marketed by Society for Theriogenology, which has got front and the back, and you're looking at the front side of this form, which needs some information on animal identification, his age, examination date, and the back side of the form has all the findings that you are going to put into for semen examination. But I have seen quite a few different private practices who have designed their own forms, which works fine too. Whatever you think that information is correctly noted is the most important thing. Now, those of you who want to review the reproductive anatomy of the stud dog, here's this picture from Dr. Sanger's book showing that you have obviously sperm produced in the testes. You can see here on this picture, and has a little blue line on it, which shows that that is the epididymis, and sperm from testes are transported to the epididymis. They are stored in the tail of the epididymis before animals start ejaculating. Then the sperm goes from the tail of the epididymis through vas deferens to be mixed with fluid from prostate gland, which is the major accessory sex gland in the dog. And then that fluid, along with the sperm, what we would call then semen, comes through the urethra in the female, or if you want to collect it. To make that process happen, as you may recall, there is quite a few other stuff involved, especially the hormones, the endocrinology of the male. You can see this picture was originally from Dr. Shirley Johnston, who used to give quite a few lectures to us and all over the United States and the world. Here she shows that we have that hypothalamus, as you can see in the yellow area, which releasing hormones, go to the pituitary gland, and from there two major hormones, follicle stimulating or FSH and LH, are released, and then they go to the testes and form their influence and have testes production. And then from there also there is a hormone testosterone produced. And the testosterone is the one which gives the male sexual behavior. And that testosterone has a very interesting feedback system with the hypothalamus and pituitary gland. Now, those of you who haven't had a chance to really look very closely at the canine penis, as you can see here, I'm holding with my hand the on the top of the bulbous glandus part of the penis, and penis is erected in this picture. And then the penis in the female is inserted non-erected. So the penis has enough firmness that it is inserted in the female before even gets completely erected. How does that happen? It's a very unique in the dog that it has got a bone in the penis or os penis, which provides a rigidity to the penis that penis is able to get in. And once it gets in, and then bulbous gland is engorged, and then penis is locked in, so to speak, in the female up to the time when he completes ejaculation. So the process is very interesting, as you can see in these series of pictures here. On the top, on your left-hand side, as you can see, the male has inserted his penis, non-erected, and then pretty soon erection happens, and the bulbous gland is engorged, and the male turns around almost 180 degrees. And then he stays locked in, as you can see on the third picture down. So essentially it's a back-to-back of male and female, and it stays in there until he completes his ejaculation. And it's very interesting that the engorged penis stays inside in a way so it's completely enclosed, that the area of the cervix, or I should say vagina, not the cervix yet. And then he keeps on ejaculating. It may take as much as 20 minutes or sometime an hour, so that these animals are really locked in until the penis is done in terms of ejaculation. So for breeding soundness examination, we need to make sure that we want to know the historical background on this animal, what has happened, and also the medical history. Is this animal has been ill in the past, or is on any medication at this time, or is he updated on vaccinations and all the past illnesses and lab results, whatever you can get hold of it. It'd be good to have that. And then any previous semen evaluation, if it was done, I would like to see those records. And then one of the most important tests this animal should have had done is the Brucella canis. So without going into too many details about Brucella canis, I think I'd just like to leave it at that, and then we will discuss at some other time the importance of Brucella canis, or you can look it up. And if he was bred, I would like to know, the litter size, and then how many bitches did he bred, and how many got pregnant. And sometimes clients have their own, interpretation about pregnancies. If that's the case, I would like to make sure how that pregnancy was diagnosed, because sometimes just a visual observation of the bitch really doesn't tell you if bitch was pregnant or not. So on the physical examination, as you know, on the breeding, when, as you can see in this picture, when male dog is mounting the female, almost 60-70% of his body weight is on this back legs. So if the dog is lame, it will be difficult for him to mount and to stay on. So we are going to keep eye on those areas that which may interfere in the breeding or in his sexual desire. Then comes to the examination of the reproductive tract. Now, some clinicians prefer to do this exam after the semen collection or breeding, and part of the reason is that they don't want to distract the male, but either way is fine. So we want to make sure this animal has two normal testes in the scrotum. It's very important. If we have only one testis that you can palpate, then that animal would be cryptorchid, which is abnormal, and those animals should not be bred females. So I would like to make sure that animal has two testes and they both have a normal consistency. They shouldn't be too soft or too hard. So I like to have both hands, as you can see on right hand side. I'm trying to figure it out, if it's a normal consistency or not. Then is time to semen collection. Now there are different ways. Some time ago we used to use rubber cone, as you can see here in my hand, attached with a tube. But nowadays I have seen many of us, including myself, just use disposable plastic cone, which is available. But whatever you prefer, the bottom line is how you can apply that cone on top of that penis. We just push that prepuce gently back and then apply this cone on this non-erected penis. As you can see, which I've been talking about earlier, that once you apply that cone, and then you want to go behind this bulbous glandus. With the gentle pressure behind this bulbous glandus, you will see it starts engorging, and then you will have the semen collected in the tube. So this is a situation, as you can probably see on the top of this picture. My hand is on top of that bulbous glandus there. We have to keep in mind that dog ejaculates in three different phases, and there's different three parts, in fact, of the ejaculate. The first is a small quantity of pre-sperm or pre-ejaculate, which is relatively clear fluid, follows by sperm-rich fraction, and then the last one is the clear or prostate fluid, part 3 of the ejaculate. So that part 3 prostate fluid keeps on coming from the animal's penis, and it may last for quite a while. So for our evaluation, we really don't need to sit for 20 minutes to 1 hour. I think I try to stop a few seconds after I see that after a sperm-rich fraction, I have a clear fluid coming out. Then I stop and then try to take the semen and then evaluate. And at this time, it gives the opportunity to also examine this penis. If there are any trauma, any old wounds, I think should be noted. I'd just like to point out here the importance of prostate gland, which is the major gland in the dog, which is sitting at the neck of bladder, which has got many other characteristics that I wouldn't go too much in detail, other than telling you it's a walnut shape and has bilobed, and it's a very symmetrical and relatively smooth. Should not have any bumps or any dumps in it. So what I do is, this is our last thing which we do on the examination, because it's not the most comfortable thing for the dog. So I put a glove on my hand and lubricated index finger. I put inside the rectum of the male dog and try to go all the way with my finger until I feel this bilobed prostate gland. On the left-hand side picture is the picture of a real urinary bladder and the prostate, at the neck of the bladder. So what we are really looking at is, on average, is the color of the semen should be milky white, as I mentioned earlier. Prostate fluid should be really clear, like a watery fluid. And then we try to make a note of the volume. Obviously, if you collect too much prostate fluid, you have a large volume. But that's really not that critical, but it comes out when we try to evaluate it. Then we look at the sperm motility. So you can see here in two tubes, the tubes itself is not very clear. So, but the right-hand side, which is a milky white or off-white color, is a semen. And on the left side is the clear fluid, which is a prostate fluid. And then we take from the semen a drop of semen on the put on the microscope slide, make a smear, and I prefer to have a really warm slide so that I can see those sperm moving under the microscope. So we are looking for sperm which are moving in progressive forward manner, which will be estimate of sperm motility. Sperm motility could be measured with quite a few different techniques and technologies, but an everyday practitioner probably doesn't justify very expensive machines which can do it for you. So we will do that, and then taking again a drop of semen, making a smear out of that, air dry it, and stain it, and then look under the microscope. As you can see here on the picture, reddish picture is the bent tail from for the sperm. And if you come down, look carefully on the black and white pictures on left and extreme corner is the shape of a normal sperm. And then from there, you have all kind of different abnormalities. So the abnormalities you see in the head of the sperm, what we call head, could be very tiny, small, or micro head, or very big head, like, macro head. And some of the other abnormalities would be primary, those abnormalities which might have been happened during testicular journey of the sperm, during spermatogenesis. But the abnormalities which we suspect happen during epididymal storage or transport are man-made problems, means that if semen is, given some cold shock, for instance, you will have a lot of bent tails. So those are the secondary abnormalities of the sperm that we will count. So the bottom line is that we are looking for a normal milky white color of the semen. The volume, again, varies quite a bit, but here for ease of remembering is about 30 milliliters. And sperm-rich fraction, which is the bottom line we are looking at, which is somewhere, it could be as small as half a cc to 3 milliliters. Sperm motility is usually very good in the dog. I love to see more than 80% motile sperm, and then normal sperm about the same, just ease of remembering. So this is really the complete breeding soundness examination. Many times, especially those times when semen doesn't look good, I even invite owners to look in the microscope and then try to explain to them, what is normal, what is abnormal, so they are satisfied, and it also helps you, for them to pay bills. So it works out very well for all of us. So if you have any questions or any comments, please go ahead and put your questions and the comments in the comment area of the YouTube, this video. I'll be more than happy to answer those. Until then, I wish you well. Bye-bye.